Welcome in. We're talking kids with our friend Dr. Caitlynn, and we were talking about adenoids. Who needs them, huh?
Well, yeah, and so think about the adenoids, and this time of year, tonsils adenoids are the tissue that live in the back of your throat and kind of under your palate, and so they can get infected. There's a specific virus called adenovirus, like adenoids, right? And if you have had a kid who has tested negative for all the things in the past couple of weeks, that's probably what they had.
Okay.
Right? Because it's a virus that's very mimicky of kind of flu and a little bit of strep, and it can kind of do.
It's not the first thing parents think of.
No,
that's lower on the list of it's got to be this, it's got to be that.
And with all this stuff going around, I mean, we've had a really nasty flu season, some COVID, we've had tons of strep all year, and you kind of look in the throat and you go, oh, that looks streppy, and they have a high fever, and they have a little bit of snot, and then you do the test and you're like, it's not strep, right? And so it is one that can cause pretty significant sickness for kind of 5 to 7 days. The other part of it that you don't tend to get necessarily with strep and flu, although you can, is it can be a tummy bug too. So lots of crampy abdominal pain, vomiting, diarrhea. I mean, it's just like the gift that keeps on giving. So if your kids kind of had those symptoms, and pink eye, yeah, at the very end, you can get some pink eye too.
So if you determine that it is the adenoids and that they are infected, what's our course of action?
So it's a virus, right? I mean, you can end up with little secondary ear infections, pneumonias, bladder infections from this, but typically in the first 5 to 7 days, it's just going to be the virus, right? And doing antibiotics isn't going to really do anything except for maybe make the tummy a little bit more upset, right? So, you know, it's hard this time of year. Everyone's getting ready for spring break, and you're like, I just want them to feel better. And so I'm really like trying to stress parents, I know it's bad timing, but the antibiotic really is not going to help this, right? And so the treatment is supportive care, lots of fluids. It's pretty easy for them to get dehydrated because little ones, you know, under age 5 can get 103, 104 fevers with this for up to 5 to 7 days. No appetite, so just making sure you're really watching their hydration status, making sure they're drinking. They probably aren't going to be very hungry, but just pushing that fluid is going to be really important for
them. And then you start thinking about that travel insurance you should have taken out because kids just have an amazing ability to get sick
right before vacation.
Right before that plane flies or that car drives. So, Dr. Caitlynn, thanks for this. Good information.
Yeah.
Back with more. Stay with us.